Catrineau and Deputy City Manager, Communications and Engagement. Thank you.
Well, good afternoon, everyone, and thank you for coming in today. Is everybody good for sound? Yeah? I know that many of our community members are feeling higher levels of anxiety, especially given yesterday's news of the school closures and the need for many parents to stay home with their children, where balancing their work commitments where possible. And as a parent myself with school-aged children, I personally understand how challenging and disruptive this change has been. And so I want to assure Edmontonians that we continue to do everything possible to monitor and follow the advice of public health officials, to consider supports for vulnerable Edmontonians, and to look at supports for our local businesses. The situation remains, of course, very fluid, and Adam and his team are assessing on an hour-to-hour basis, and they're in regular touch with the appropriate provincial authorities, and he can speak more to that in a couple of minutes. I know many of you have been asking about why we haven't yet called a state of local emergency or shut down. This will be available to take your many questions.
Thank you, Mr. Mayor, and good afternoon, everybody. Today I wanted to provide an update on the decisions that the city has made. Before I get into that new information of the day, let me say a word about the City of Edmonton staff. Together, thousands of city staff are supporting one of two things: our efforts to plan, communicate, and action the many necessary steps to address COVID-19, and our efforts to keep critical services running. Across the city, staff are working differently. Sometimes doing different work, some doing their regular work in a different way to keep the city moving. I'm so proud of the employees stepping up to the challenge. To all city staff, thank you for your professionalism and your calm. There is one member of staff who is especially in my thoughts today because that employee has tested positive for the virus. I recognize this might cause uncertainty for many other staff, and I want to be clear that we are responding calmly and effectively to it. Our priority is always health and safety, both for our employees and the broader public. First, let me reassure you that the person who tested positive is in self-isolation at home, as Alberta Health Services has directed. We care about our employees' well-being and will continue to be in contact with them throughout to provide support. I cannot tell you the name of the person or the specific work location because we must respect the employee's privacy. What I will say is the employee did not work in a downtown location where many staff are concentrated and is not in frequent contact with the public. Nor did the employee work in a recreation center, so this news is completely unrelated to the decision of the weekend to close facilities. Second, all close colleagues and contacts identified through the Alberta Health Services active tracing have been contacted. If you are an employee and you have not been contacted by AHS, you are not at risk from this specific case. To those employees who have been contacted by AHS, we will support you and accommodate whatever testing and isolation requirements you need to protect your health. I can only imagine how stressful this situation is and know that we have your back. Our third area of focus is the facility where the employees worked. We have consulted with Alberta Health Services, and there is no need for this facility to close. The employees' workspace and all nearby areas have been thoroughly disinfected. This is our first case in the workplace, but public health reality is that there will be others. As colleagues, let's remember that we have a role to play in keeping our workplaces healthy. As Dr. Hinshaw has reminded us repeatedly, if you're sick, please stay home. I'd now like to speak to Edmontonians and let them know what the city has been doing. We recognize that other communities have declared a state of local emergency. That is one legislated option available to municipalities to respond to situations like this. I can't comment on the actions of other municipalities, but I can confirm we are monitoring them. There are other options, and we have chosen to use those. They are just as effective as protecting the health and safety of Edmontonians and our staff. Edmonton has activated our public health emergency plan, which is part of our municipal emergency plan. We've established a task team and empowered them to make essential decisions we need. This approach is bringing together all the key decision makers, and it is working well under the circumstances. That task team is chaired by David Aiken, who is here with me today, should we get into questions that need more specifics. On Saturday, the city made the decisions to close all community rec facilities and attractions. The decision was made out of an abundance of caution and on the advice from public health officials. The closure will be in place until further notice. Full or prorated refunds will be given to those who have already registered for or started classes or programs that have been canceled. Further information will be provided on how refunds will be processed, and all annual memberships will be put on hold. We are following up with staff that have been involved in these closures and are working to ensure that they are not negatively affected. While our facilities are closed, many other public spaces remain open for Edmontonians to enjoy. City bylaw staff are ensuring they can do that safely. They will be following up with theaters, private gyms, community gathering facilities, and private attractions to help them comply with the Alberta Health and Alberta Health Services guidelines for social distancing and numbers. I want to thank those businesses which have already removed tables, restricted space, and created separate lineups for seniors and taken other steps to keep their customers safe. In terms of the advancement to a state of local emergency, we have a number of indicators that we review and will be reviewing on a regular basis. And should those indicators start to inform us that we need to take an additional step, we'll engage our emergency management, our emergency agency committee, which is council, to potentially recommend those steps. But at this point in time, we feel with the steps we've taken, we're managing it effectively. I'd now like to talk about transit. We recognize that transit is an essential service and that many Edmontonians completely rely on transit to move around our city. To maintain a safe and sustainable level of mobility and to also effectively use our resources, given the reduced demand due to school, post-secondary closures, and work-from-home provisions, all buses and LRT will now operate on a reduced service schedule. Starting Tuesday, which is tomorrow, we're adjusting transit schedules so that we can protect both the public and our staff. If you're a frequent transit user, we're moving to the Saturday schedule 7 days a week. If you're an occasional transit user, keep checking takeets.com for online information about when and where to catch a ride. All school services routes are also canceled. This change allows us to keep the buses on the road while also allowing us more time to make sure the buses are cleaner. We have introduced enhanced cleaning protocols so that every transit vehicle is properly disinfected. We have seen fewer transit users in the past few days, and we believe it will allow for better social distancing for taking transit. The reduced service schedule will also allow us to better protect our transit operators. All buses remaining in schedule will have bus shields, allowing more effective distancing for operators and for the customers. There is no change to DAT services at this time, and we are continuing regular operations. As I said, these changes will help us ensure we safely deliver transit to Edmontonians and that we have enough healthy staff available to provide services across the city for a sustained period of time. If you need more information, we have information on our public website at edmonton.ca/COVID-19. As Katrin mentioned, in these times, we're taking a different approach to informing you, and this is a method to ensure that from a media perspective, we're maximizing our use of technology to be able to inform you and share with you information. And the Mayor and I are available to answer any questions that you have at this time.
Just, we'll probably start with you, Adam, but could you lower the mic a So you can see your face. So we'll start probably all the questions with you.
Sounds good. Okay.
So can you just talk about transit? Have you guys crunched the numbers? You know, how much has demand gone down? And then can you just expand on what's going to happen tomorrow?
Sure. So in terms of what's happened with transit and what's going to happen tomorrow, and what are the indicators for these decisions, I think we've seen approximately a 22% decrease in transit ridership on the basis of the measures that folks are taking as it relates to following the guidelines from Alberta Health and Alberta Health Services, and that'll likely increase related to the school closures. So the steps that we're taking is actually tomorrow, Tuesday, moving to our Saturday service throughout the week. And so that's a way to better balance user demands and the need for the buses, the infrastructure, and also provide us an opportunity to really take the time to ensure that we're cleaning from an intensity perspective that reflects the situation that we're currently in.
So does that include the LRT as well?
The LRT actually a bit of a different approach in that to support the social distancing, we're going to be adding, in some cases, a car where previously we hadn't, to provide maximum capacity for that social distancing. In terms of frequency, I think we're still evaluating the frequency of the LRT system, but that one's a little bit more definitive in terms of location and consistency. And if there are variations, again, we encourage you to follow our information on the website. The other thing that came up recently related to transit, specifically LRT, we're moving to a system where when they get to stations, the doors will open automatically without the push button.
So all doors?
All doors, and I think we're there, David, in terms of those doors opening. So we've taken some steps to, again, minimize the location where hard surfaces could cause a contact issue.
What about buses? Would riders still need to push a button to request a stop, and also paper train service were also a concern?
I'd look to David to help with that. I do believe the bus operators are opening the bus doors. In terms of transfers, I think we're still working through that actually. We're with the closure of the rec facilities, there is a gap in terms of the ability to buy passes, and so we're currently working through the mechanism in terms of transfers and the ability to use the tickets and the systems that we have.
So going to the Saturday service it means reduced staff, or are people just going to be asked to stay home, or how is staffing going to be handled?
So the question was, in terms of going to a Saturday service, what's going to happen with the staffing? Something that we're evaluating at this point in time. I don't have a definitive response to that. I think, and not to be alarmist, but I think the fact that we have a case with a City of Edmonton employee and all the public health indicators are pointing to this, that we could see other impacts, and we want to make sure we're prepared for that. This is a way to help us prepare for that in terms of staffing complements. At this time, we don't know what that's going to look like, but we'll continue to work with our employees and the unions to let them know how we're going to manage that.
On staffing, for those employees who need to self-isolate, and those employees who don't have their shifts anymore, rec centers that have closed, are they being compensated? Can you take us through that?
So the question is, for staff that have been impacted by closures or reduction in service, what are the steps that we're taking? So we are, as much as possible, looking at adjustments in terms of staffing levels to reallocate potentially to other business areas if their skill set provides that. If not, we've put them off, or we've asked them not to come into work. It's a leave with pay scenario at this time. And on the basis of revisiting the timing on whether the transit system services increase or the rec facilities or attractions opens, we would revisit. So we're continuing to monitor the impacts on those service levels or closures, but at this point in time, our staff are home or are off with pay, and we'll evaluate.
Is that the same for those staff who might need to take care of children now that school is closed?
So the question is that the same for staff that would have to look after children with the closures of the school? A little bit different in that what we've identified for our staff that we would provide 5 days, non-consecutive 5 days, for them to work out childcare arrangements to figure out how to make that work. I think one thing we're doing and encouraging for all of our staff, if their situation permits it, we encourage them to work from home. So if your job permits you the ability to work from home, we're actively encouraging our employees to do that. It's something that we need to make sure that we do to still maintain the key services that we have. But those are some mechanisms that help with that, and some will say that it's difficult to work from home with your children in the house.
Staff going to be, you mentioned just kind of policing, I guess, the last stations. How will that work?
So the question is, what are bylaw staff going to be doing? Are they policing? And the answer is they're not going to be policing necessarily, but I think they're going to be monitoring and encouraging. And what we're seeing, and I mentioned this in my notes, what we're seeing from the business community is really good, that there's an element of self-regulation that's happening with those businesses, that they're following the advice from Alberta Health and Alberta Health Services by restricting numbers, by accommodating a specific time for seniors, by removing tables to maximize the opportunity for social distancing. So at this point, it's a bit of monitoring and thanking the business community for taking those steps to follow Alberta Health Services. But I did mention that if there is an indication that we're seeing something different, it's one of those indicators that may push us into a conversation with the Emergency Advisory Committee, which is council, about potentially pursuing other measures like a state of local emergency.
So with the state of local emergency, are there any plans right now to institute more sweeping capacity bans? Like you just heard in the States, they're limiting it to now 50. And, you know, respecting you don't want to supersede the advice from the medical officer of health, who makes that call, and, you know, can you take us through that thought process?
So the question is there thinking to do a further reduction on some of the parameters that Alberta Health or Alberta Health Services has provided? I think our approach to this, and I mentioned this before, is to be proactively prepared but responsive to the advice from Alberta Health and Alberta Health Services. So I feel like the steps that we've taken have been that under the guidance and advice from Alberta Health and Alberta Health Services, we've been prepared proactively to take the necessary steps. So I don't see that at this point in time, but certainly we're in close contact with Alberta Health Services, and should one of those indicators push us in a direction where we need to do something different, we'll exercise those municipal authorities.
What would declaring a local state of emergency allow the city to do? Would that be required to institute a 50% capacity rule like we see?
So the question is, what would the state of local emergency allow the municipality to do? It would give us different powers. And so it could, like in Calgary, provide us the opportunity to command a reduction in capacity in certain facilities. One of the indicators that we have identified is if we're starting to see a significant issue with available resources or pricing that puts folks in a difficult situation to be able to gain those resources, those are examples where we can implement that state of local emergency and then assume some powers around capacity in facilities, price control, ensuring that the appropriate resources are making it into the community and are being allocated appropriately.
So like rationing of some sort?
Well, I can't really comment on the degree that we would go, but it would just give us some powers to ensure that we're approaching this from a control perspective in the current situation that we're in. If I could add one more, in close contact with the provincial government, I think folks are aware they've activated their provincial operations center. We have some of our emergency operations folks that will be in that provincial operations center to be able to provide a good connectivity to the city of Edmonton, and that helps us be able to be proactive in terms of whatever sort of response we have. So in addition to the public health emergency plan out of our municipal emergency plan, we've also got our emergency operations center staff right in the provincial operations center to be able to provide a seamless connection in terms of communication.
Sorry, one more quick question. one employee who tested positive, what was the circle? How many had to, within the circle, I guess, of the self-isolation?
The question is, for the one employee, how many were included in that? And I can't disclose that. I can just say that work closely with Alberta Health Services to follow the active tracing, which is employees and personal, and steps were taken. And our thoughts are with that employee, and we wish them full recovery. And when they have recovered, we'll welcome them back arms wide open.
I have one more question based on that. Can you confirm if the travel was business related?
Oh, sorry. Yes, in terms of the employee and the case is confirmed that it was travel related.
Was it a business travel? Can you see that?
Actually, I don't believe it was, but I don't know that for sure.
Adam, just in follow to Calgary declaring a state of emergency, and I know we don't have to take their cue, but can you explain a little bit more why we're not doing that at this point?
So the question is, why aren't we taking the state of local emergency step like Calgary did? And again, I can't comment on Calgary's decision. What I can tell you is that with our COVID task team, with our proactive steps to close rec facilities, with the steps that we've been taking with our staff to minimize our impact to being able to provide the key services to Edmontonians, with our activation of our public health emergency plan, we feel those steps have been appropriate. That coupled with the response that we're seeing from the community, in particular the business community, folks are following the advice from Alberta Health Services. So we feel like in the Edmonton way, people are responding accordingly. They're calm, they're compassionate, and they're supportive. And so I think if we see any indicators that put us in a situation where we're not seeing that, we would then take the next step.
So how often, how can you monitor every restaurant, bar, shop, with
As I
bylaw?
mentioned, so the question is, how can you monitor? We have bylaw staff that are out there doing monitoring, and not from an enforcement way, but from an encouragement way. And then we have with our task team, they're meeting 3 times a day. They're updating the executive leadership team and appropriate folks regularly. And we're making decisions by the minute, by the hour, that we feel are the best for Edmontonians. Thank you.
Just want to supplement Adam's comments about the state of local emergency. I've been in close contact with the Mayor of Calgary to understand, close virtual contact, I should be clear, with the Mayor of Calgary to understand their motivations, and they're really unique to some of their local circumstances, and so I wouldn't presume to speak for them, but certainly in all of the preparedness work that our council has done, we've been very mindful that declaring a state of local emergency entrusts extraordinary powers into municipal officials, and you only want to do that when it's absolutely necessary. And in our estimation for Edmonton, we're not there yet. Some of those powers include the ability to seize assets, for example, and to implement price controls, and to issue firm orders to limit gatherings. But our view is that as long as the medical officer of health is giving those direction across the province in an evidence-based way, that we should defer to that and escalate in step with them. And also that, again, as Adam said, we're seeing not just calm and not just compassion, but also compliance from Edmontonians and business leaders who are very, very mindful of the safety of their own employees, just like the City of Edmonton is worried about our staff. I've spoken to a number of small business owners who want to stay in business, want to continue to be there for the public, but also want to make sure that their staff are safe. And so we would encourage businesses to voluntarily take steps, particularly in the hospitality space, to support that social distancing, spaces between tables, limiting their own occupancy on a voluntary basis. Again, the city could step in, but just to enforce that, a state of local emergency allows for much more than that. So as long as people are taking those steps proactively, which for the most part it seems they are, then we don't need to take that extraordinary step. That said, I can call a meeting of the Emergency Advisory Committee, which is essentially council, but it meets in a very specific way to put state of local emergency in. I can call that meeting with 1 hour's notice. And I've discussed with council that we should be on standby for that, not because we believe it's imminent, but because we should be prepared to do so at a moment's notice because the situation is moving so fast. So if the facts warrant, we're prepared to step in at a moment's notice, really on an hourly basis, to deal with this question of escalating delegated authorities to city staff. But they haven't asked for that yet because we're seeing that good compliance from individuals and from businesses. And the longer we can do this on a cooperative basis rather than on an extraordinary measures basis, the better I think that is for everyone.
The state of local emergency is the next card to play. Are there other cards to play after that? Is there other places you can go?
Well, Adam could speak to the other escalations. State of local emergency is actually not the immediate next step for us. The activation of our emergency operations center, there's one more stage of escalation that's within the current delegated authority of the city manager. And then the subsequent steps could include a state of local emergency, but we're not there yet. Things are working well. We're adjusting and able to make decisions. You know, limiting transit service, for example, doesn't require council to meet and doesn't require, you know, extraordinary powers to do it. And so the system's working well within the delegated authorities that are laid out for the city manager and his team.
Is there forbid local state of emergency?
Even during the tornado? Not recently. It's yeah, not in the 13 years I've been here. I haven't seen a state of local emergency. We prepared for one, but we haven't needed to take that step. If necessary, we'll go there, but we're just not there yet.
Can you talk about your conversation with the Premier? Obviously, the other factor people are concerned about are the impacts on local business and the state of the economy. What can you tell us about that?
Well, our meeting certainly focused on the state of Alberta's economy and issues affecting business. We did also talk about vulnerable Edmontonians and vulnerable Albertans. However, the levers of government that are in the hands of the federal government are perhaps best deployed to support people in terms of their day-to-day needs and incomes, though not for me to speak for the Premier, but certainly there's a role between the province and municipalities as well. But our conversation focused on liquidity for business, liquidity for government agencies and organizations like the City of Edmonton and other municipalities to carry on our essential work. And we also focused on measures that could be put in place to support cash flows for businesses, which will be in difficult circumstances in the coming weeks and months potentially. So we didn't get into specifics, and there's nothing to announce because these would be provincial announcements. But I will say I really appreciated the Premier's willingness to seek advice from me and from other municipal leaders over the weekend, and sense a sincere commitment to be there to support vulnerable people and businesses that are struggling, not just in our city but across the province. Because it is a dire time. It was a dire time before this, and now the layering effect is a real challenge. But and I'm hearing from business leaders who are very concerned about what the next few weeks and months are going to look like for them, and so. We focused a lot on measures that the city could help the province implement to support businesses, and we'll have more to say about that in the coming days.
What are the plans to protect the homeless, the most vulnerable population?
Well, vulnerable people experiencing homelessness are at tremendous risk, and that's been something we've focused on in almost all of our conversations. Because of inadequate housing and because the shelter system is not structured to support social distancing, and when the virus does reach those vulnerable populations, it is going to be practically very challenging to support isolation for people for 14 days. while they recover. And so, but I know that the City of Edmonton Task Team is working with agencies to try to find some solutions. We have facilities that are shut down that may be able to be repurposed on a short-term and interim basis. I know a lot's being explored, and that certainly from Edmontonians, they're concerned about every single one of their fellow Edmontonians, including our most vulnerable. That was the case before this, and this is just yet another opportunity for us to show compassion and our commitment to inclusion. So I know it's something that City Administration and the COVID Task Team is looking at specifically, but we don't have anything specific to announce today other than our continued commitment to work on that issue with the agencies on the front lines.
Just before coming here, there was a large group of people in front of me. This will just be very close contact, maybe looks like over 100 people. There's not much.
Well, it being a colder time of the year is making this more challenging as well, and so it's hard to support social distancing in lineups when people are trying to access services. So it's going to be very challenging in that community, and our community's response and the province's response to it. I've always seen homelessness as a public health challenge primarily, so overlaying the urgent crisis of COVID on the long-standing crisis of homelessness, I think this will be a test of what we're capable of as a community and as a province. But I think we're very committed as Edmontonians to try to support safety for people experiencing homelessness and who are at greater risk for a variety of reasons. Thanks, folks.
Thank you.
See you tomorrow.